I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month I'm talking about what I took away from my recent experience as a patient. Basically, it was an accident involving yard work on a wet and slippery day and a heavy ladder. Long story short, I ruptured my quadriceps tendon and broke my kneecap, which required surgery. That was followed by several weeks off my feet when I couldn't even bend my knee. Actually, today is one of my first days out of the house. So while this is still fresh in my mind, I wanted to share my experience with you. Frankly, it's not easy being a patient. It's particularly hard to be the person with the questions instead of the person with the answers. In this situation that I want to share with you today, we were getting our discharge instructions, preparing to leave the hospital, when the nurse told my wife, Katie, very casually, "You'll have to change the dressing in 2 days." Now, Kate is not a professional caregiver. She's been down this road before after my shoulder surgeries, and she remembered that changing the dressing was difficult then. She hated it. So Kate wanted more information about what to use and expect. She asked the nurse, "What do we use to change the dressing? What should I expect?" We never did get a straight answer, and we went home without clear instructions about the type of bandage and adhesive we needed. We both felt unsettled about what ended up being a minor issue. I'm sure the nurse didn't intend it that way, but it felt like she was giving us a dummy message when the reality is that this was new territory for us. The key takeaway is, put yourself in the patient's shoes. Patients always have questions or concerns about some aspect of their care. It might be clinical, it might be financial. Those issues may not seem like a big deal to us because we deal with them every day. But listen closely the next time you hear a patient focusing on a seemingly minor issue. Often you'll hear that what the patient is really saying is, "I'm scared, I'm worried. I have to leave this place and I'm not sure what happens next." It's easy to forget that most patients are patients only rarely, so things that seem routine to us are not small potatoes to them. When HFMA worked with other groups to develop the patient financial communications best practices, we kept that thought in mind. When I was the CFO at Spectrum Health Hospitals, I used to tell new employees during orientation that we have 60,000 admissions a year, which is a great thing for a CFO. But how many admissions does the patient care about? That's right, 1. Sure, think about the language that you're using. Are you using jargon? Are you using terminology, acronyms, or codes that are understandable mostly to industry insiders? When you talk to patients, assume that they are going through this for the first time. Assume they know nothing about how hospitals or health insurance work. And remember, tone of voice is critical. Do you really care, or is this just another thing to do? Your tone of voice will answer that question. Most people who choose healthcare as their career are motivated by a genuine concern for others. We need to reconnect with that motivation each time we interact with a patient or family member. By listening and watching for understanding, honestly and sincerely, we can truly hear what patients are saying and help them find their way through. That's the spirit that built HFMA's Patient Financial Communications Best Practices, and it's the spirit that should guide all of our interactions with patients. Thanks for watching. I'll see you next month.